Bismillahirrahmanirrahim. The quote for today is have more than you show, speak less than you know. Today, we will delve into the intricate world of hospital management. This presentation aims to provide a comprehensive overview of the classification of hospitals, functions of hospitals, management of hospitals, organization of hospitals, and hospital accreditation within the context of Pakistan. I am Dr. Muhammad Abbas Gill, and I am giving this presentation under the kind supervision of Professor Dr. Saira Afzal. Now, the history of the hospital development. Hospital is an Italian word and it is derived from the word staff, which means patient, and serpent means caring of. In the United States, the first hospital was in Pennsylvania and it is founded in Philadelphia in 1751. The factors that are responsible for hospital development are advancements in medical sciences, development of professional nursing, advancement in medical education, contribution by the industries, support of the health insurance, and role of the governments. The hospital can be classified based on their number of beds, ownership, duration of stay, and the type of services that they provide. There are some general hospitals that provide general services, and some are specialized hospital like the children hospital who provide pediatric services, and others that or others that is PINS that provide neurosciences services. And there are other hospitals that are classified based on the number of beds, like the BHURS district hospitals and the teaching hospitals. And on ownership, they are divided into public or the private hospitals. And duration of stay, they are divided into long duration or short duration hospitals. The functions of hospitals are curative, preventive, and promotive services. They may provide domiciliary care. They are also involved in research and training. They deal with the accidents and emergency services, and they are also involved in disaster management. They provide physiotherapy services, diagnostic, geriatric services, and medical record keeping. Hospital management. It enables our patient, doctor, nurses, team to do their work as easily, efficiently, and economically and develop caring environment in the hospital. In the hospital, there is the unity to command, span of control, homogeneous assignment, and the delegation of the authority. The functions of management are planning, organizing, leading, and controlling. Now, the hospital planning. A successful hospital is based on a triad of good design and construction of a good administration. Guiding principles for effective planning are high quality patient care, effective community orientation, and economic viability. High quality patient care. Appointing a competent and adequate number of medical nurses and other professional staff, providing necessary facilities and equipment and support services, establishing an elaborate organizational structure ensuring proper accountability, instituting a team approach to patient care, establishing and enforcing standards in patient care and the system of clinical audit, provide a mechanism for continuing education. Effective community orientation, covering ward having representation of non-respected leaders of the community, extending programs and services of the hospital to the community, providing a public information program to keep the community aware of the hospital goals and services provided. Now, the economic viability. Making available adequate operating finance for personnel and equipment necessary for providing quality patient care, maintaining full occupancy and retaining full professional staff, planning new services and expansion programs based solely on community needs, a plan for financing replacement of equipment and improvement of facilities, an annual budget that will help the hospital to remain at the forefront of medical technology and knowledge. Now, these are the steps to establish new hospitals or expansion of the management system. The first is the feasibility assessment, then functional assessment, financial planning, equipment planning, plan hospital building, and hospital commissioning. Now, coming towards the feasibility assessment. An unbiased and professional approach to carry out the task, either a consultant or a committee of experts. Aspects to be studied include financial viability, needs and possibilities of the community which the hospital is going to serve, study of the existing hospital facilities, appraisal of hospital capacity and bed requirements, study of the required staff and services. The next is the functional planning. That is setting up a project management unit team, The list of issues to be dealt with include raising funds for the construction, preparation of the plans and specifications. Then there is the functional planning. That is the building contract. Bind the contractor to the construct the building according to the authorities' plans and specification under the specified time and limit. Provide penalties for the delay. Provide for the scope and correction of the work. Financial planning. It is a very important task of in hospital management. Construction equipment and furnishing hospital. For all these phases, the the most important part is the financial planning. Operational funds. Operational expenses in the initial phase are far higher than the revenues expenses on accounts of salaries, repayment of loans, operational and maintenance expenses, insurance against fire and structural damage. Plan hospital building. Integrated third department for the smooth flow, maximum light and air, separate the entrance for the public, separate the entrance for OPD, firefighting setup, critical decision, space estimation, distribution, and design work. And at the end is the hospital commissioning, assemble equipment and staff, first skeleton staff at incremental staffing, train staff, test installation, right mission and objectives, operational policies, rules, organizational departments. Organizing hospitals. Hospitals are the mechanistic organization. They should have rigid departmentalization. They should have high specialization, decision making done on top level, and top manager is the hospital administrator. This is the scalar principle. It needs to be described here that, and the scalar principle states that there is a clear line of authority for communication except in case of emergency when residents can contact the director without crossing the ladder. Persons reporting directly to the administrator are the medical superintendent, nursing superintendent, associate assistant administrator, coordinator, community health programs, and the principal of the school of the nursing. Now, the leading hospital staff, hospital administration. The term covers a large number of activities that may be categorized as preparation of the hospital, legislation and planning of the hospital as a whole, and establishment of the architecture, control, and standards. Application of hospital legislation and social assistance provided by the authorities responsible for hospital services. Daily running of the hospital by administrators are concerned with the personal, finance, and technical services. The role of administration. They play a role in planning for the future while managing the present affairs, ability to produce and accept new and creative ideas, ability to coordinate, bringing harmony and collaboration, ability to analyze, synthesize, and integrate diverse information. They have a sense of equity, fairness, and social justice, and the administration has the knowledge of skills and experience. Now, the elements of management. These are personal, financial, material, and time management. Personal management is the function of the caring for the staff in organization, and the steps for personal management are human resource planning and recruitment and selection. Next is the financial management. Financial management refers to the strategic planning, organizing, and tracking and controlling of an organization's financial resources to achieve its objectives while ensuring financial stability, sustainability, and optimal use of funds. The budget involves the formal financing statement of the policies, plans, and goals that are designed to ensure that actions are taken within the boundaries. Now, there is the development fund that is used for new processes, and the non-development fund that is used for salaries and daily expenditure. The tools for measuring budget are monthly statement, access statement, accounting, and auditing. Next is the time management. Time management is the process of planning, organizing, and controlling how you allocate your time to various tasks, activities, and responsibilities. It involves making conscious choices about how you use your time to achieve your goals and priorities efficiently. Hospital administrators should be able to control and fully consume the time of subordinates for the welfare of the patients. Now, the material management, the supply of the right thing at the right place at the right time and at the right cost. Controlling quality of services in the hospitals. That is the monitoring of the quality. That is the quality assurance by international organization of standard certification, clinical audit, clinical governance, continuous quality improvement, challenging the organization's environment, greater nursing autonomy, better relationship between doctors and nurses, supportive culture, and among clinical staff. Next is the changing the payment mechanism, that is pay for the performance. Quality efficiency of hospital services influencing perspectives. That is a client-oriented perspective that is access to the service, use of service, quality of care, responsibilities to clients and needs. Provider-oriented perspectives that is freedom of professional judgment and activities, maintenance of proficiency and quality of care, educate compensation, maintenance of professional norms. And next is the organization oriented perspectives, that is cost control, quality control, ability to attract clients, ability to recruit employees, and mobilization of community support. Now there is a criteria or the standard for hospital beds. WHO and World Bank recommended of one bed for a population of 1,000. The new proposed yardstick for space per bed for Tehsil headquarter hospital and district headquarter hospital is 500 square foot. The existing space per bed is 250 to 300 square foot. That is highly insufficient to cater to the bedside and other necessary requirements. Our WHO study of 18 low, middle, and income countries revealed that in district hospital, only 55% of beds were occupied on average, well below the recommended level of 80 to 90%. So the overview of the hospital management in Pakistan. Hospitals in Pakistan face numerous challenges, including limited resources, infrastructure deficits, and a shortage of trained healthcare professionals. Public versus private sector. The Pakistani health sector is a mix of the public and the private sector hospitals. The public sector plays a vital role in providing healthcare services to the majority of the population. The challenges and opportunities are, while facing challenges, Pakistani hospitals also have opportunity for improvement through effective management strategies and policy reforms. Patient access and equity. Ensuring equitable access to quality healthcare services remains a crucial priority for hospital management in Pakistan. Now, the challenges in hospital management in the Pakistani context are, Pakistan faces a range of challenges, including inadequate funding, infrastructure deficits, and shortage of qualified personnel. Limited resources pose a significant obstacle to the effective hospital management, impacting infrastructure, equipment, and staffing. Many hospitals in Pakistan lack modern infrastructure, leading to overcrowding, inefficient workflow, and suboptimal patient care. A shortage of skilled healthcare professionals, particularly in the rural areas, poses a major challenge for providing comprehensive healthcare services. On the effective hospital resource allocation and utilization. Efficient resource allocation is crucial for ensuring optimal healthcare delivery within the constraints of limited resources. That we need is budget planning. In it, there is a developing a comprehensive budget plan that prioritizes essential needs and allocates resources strategically is essential. In inventory management, efficient inventory management practices help prevent shortages, minimize waste, and ensure cost-effective utilization of medical supplies. In staffing optimization, matching staffing levels to patient volume and needs while ensuring appropriate skill mix and training is vital for efficient operations. Improving patient-centered care in Pakistani hospitals. Patient-centered care hospital individuals need preferences and values leading to enhanced satisfaction and improved outcomes. Communication and empathy. Effective communication and empathic interactions are crucial for building trust and support with patients. Shared decision making. Involving patients in decision making regarding their care promotes autonomy and leads to more informed treatment and choices. Pain management and comfort. Providing effective pain management and ensuring patient comfort contributes significantly to a positive patient experience. Discharge planning and follow up. Comprehensive discharge planning and follow up care ensure contribution of the patient towards their patient centered care. Implementing quality assurance and continuous improvement. Quality assurance measures are essential for ensuring high quality patient care, identifying areas for improvement, and promoting a culture for excellence. The first step that is needed is data collection and analysis. In it, collecting and analyzing data on patient outcomes, hospital processes, and patient satisfaction is crucial for identifying areas for improvement. Next step is root cause analysis. Identifying and addressing the root cause of quality issues is essential for preventing their recurrences. Implementation of the best practices. The next step that we needed is implementing evidence-based practices and guidelines promote consistent high quality care across the departments. The last thing that we need is continuous improvement initiatives. Adopting a culture of continuous improvement fosters a commitment to ongoing evaluation and advancement of healthcare services. Role of technology and digitalization in digitalization of hospital management. Technological advancements offer innovative solutions for improving efficiency, enhancing patient care, and addressing healthcare challenges. Electronic health cards, strengthening patient data management, improving communication, and reducing errors. Now the telemedicine. Expanding access to specialized care, bringing geographical barriers, and improving patient convenience. Next is the remote patient monitoring, enabling continuous monitoring of patient health status, improving adherence to the treatment plans, and reducing hospital readmissions. Next thing that we need to discuss is strategies for effective hospital leadership and governance. Strong leadership and effective governance are essential for creating a positive work environment for fostering innovation and driving organizational success. Vision and mission. Establishing a clear vision and mission statement provides a guiding framework for decision making and organization goals. Transparent communication. Open and effective communication channels are crucial for fostering trust, promoting collaboration, and ensuring shared understanding. Empowered staff. Empowering staff by providing opportunity for professional development, recognizing their contribution, and fostering a culture of respect is essential for enhancing the productivity. Performance monitoring and evaluation. Regulatory monitoring and evaluation of hospital performance helps identify areas for improvement, measure progress towards goals, and ensure transparency. For the hospital accreditation system, a self-assessment and external peer assessment process used by the health care organization to accurately assess their level of performance in relation to established standards and to implement ways to continuously improve. Reduction of medical error is a key role of the accreditation process. Hospital accreditation is therefore one component in the maintenance of patient safety. International Organization for Standardization, that is ISO. The International Organization for Standardization is an independent non-governmental organization, the members of which are the standards organization of the 165 member countries. ISO certification, qualifications of doctors, they ensure the qualification of doctors and assistants, inventory control, waste management, sanitation, maintenance of all equipment and squads, fire detection and fire prevention, rodent and post control, adequate open space and parking space, medical stores, security system, waiting area, and toilets. Why do we need ISO standards for the health? Access to health services, quality care, safe medical practice and equipment, cost-effective solutions has become the expected norm of today's society. ISO works through its network of national members to bring together the foremost international expertise and disseminate it globally. ISO standard for health help ensure that individuals and communities receive the quality of care they deserve. By implementing ISO standards, organizations and companies make a proactive commitment to the principles of quality, transparency, accountability, and safety. ISO standards make it easier to compare health service, exchange information, aggressive data, aggregate data, safeguard the privacy of the individual's health. Joint Commission International. Joint Commission International works to improve patient safety and quality of healthcare in the international community by offering education, publications, advisory services, and international accreditation and certification. Professional healthcare commissions. Health regulatory body that regulate the hospital, clinics, and laboratories and other health centers. It is responsible for developing and enforcing minimum service delivery standards at all levels of healthcare to improve the quality of healthcare service and clinical governance. All healthcare establishments are required to implement minimum minimum service delivery standards to acquire a license to deliver healthcare services. Minimum service delivery standards include minimum package of service, standards of care, and mandatory requirements system specifications that must be complied with and are vital to ensure the smooth running of the healthcare facilities. These provincial healthcare commissions in Punjab is Punjab Healthcare Commission, while in Sindh it is Sindh Healthcare Commission. Now the time for the recent updates. The first article that is included is Digital Health for Optimal Supportive Care in Oncology, Benefits, Limits, and Future Perspectives. This is a scoping review that clarifies the role and impact of digital health solutions in oncology supportive care with the view of the current segmentation according to their technical features, and identifies evidence from the clinical study published about their benefits and limitation and drivers and barriers to adoption. A qualitative summary is presented here. 66 studies were included in the qualitative synthesis. Studies supported the use of 38 digital health solutions, collecting, collecting the patient response outcomes and allowing remote monitoring with benefits to patients regarding symptom reporting and management, reduction in symptom distress, decrease in unplanned hospitalizations and related costs, and improved quality of life and survival. Among those 38 solutions, 21 provided patient self-management with impactful symptom support, improvement of quality of life, usefulness, and reassurance. Principal challenges are in developing and implementing digital solutions to suit most patients, while ensuring patient compliance and adaptability for use in different healthcare systems and living environments. The conclusion is that there is a growing evidence that digital health collecting patient reporting outcomes provide benefits to patients related to their clinical and health economic endpoints. These digital solutions can be integrated into routine supportive care in oncology practice to provide improved patient-centered care. The next article is patient-centered care for patients with cardiometabolic disease, an integrative review. Patient-centered care is essential in high-quality care as it leads to beneficial outcomes for patients. The objective of this review is to systemize indicators for the care of patients with cardiometabolic disease based on patient-centered care, extending from the stages of diagnostic evaluation and care planning to intervention. An integrative literature review was conducted by searching 7 scientific databases and a narrative analysis was performed. A total of 15 articles were included and indicators related to diagnosis and care planning interventions were extracted. In the planning of care centered on the person with cardiometabolic disease, the individuality, the dynamics of the process, flexibility, and participation of all stakeholders should be taken into account. The needs of the person must be addressed through the identification of problems, establishment of individual goals, shared decision making, information and education, systematic feedback, case management, meeting patients' preferences and satisfaction with care, engagement of the family, and therapeutic management. The indicators for intervention planning extracted were behavioral intervention, therapeutic management programs, lifestyle promotion, shared decision making, education, patient information, interventions with the use of technology, promotion self-management program using technology, therapeutic relationship therapeutic, adherence program, and specialized intervention. Now the time for the MCQs. First MCQ is, a hospital is experiencing frequent delays in patient discharge due to inefficient communication between the medical staff and administrative departments. The management is considering implementing a new strategy to address this issue. Which of the following strategy would most effectively address the communication inefficiencies? Whether implement a new electronic health record system with additional staff training, or increase the number of administrative staff to handle patient discharges more quickly, increase in integrated hospital information system that allows real-time updates and communication between medical and administrative departments, or the provide incentives to staff to faster patient discharges, or reduce the patient intake to decrease the workload to on administrative staff. Which is the correct option?
C. Introduce an integrated hospital information system.
Yes, it's C, introducing an integrated hospital information system. Second MCQ, the hospital has identified a need to improve patient education and involvement in their own care plans. How can the hospital enhance patient engagement effectively? Avoid providing patients with information to prevent confusion, decrease the time allocated for patient consultations, implement patient education workshop and materials, reduce the role of nurses in patient communication, or avoid seeking patient feedback to prevent criticism. It's C, implement patient education workshop and materials. Third MCQ is, a hospital introducing a new telemedicine service to better service patients in remote areas. However, the hospital management is concerned about ensuring data security and maintaining patient confidentiality. Which action should be prioritized to address these concerns effectively? Whether select the least expensive telemedicine platform to minimize costs, implement a robust encryption and data protection measure for the telemedicine platform, rely solely on verbal consent from patients for telemedicine and consultations. Limit telemedicine services to administrative tasks only. Avoiding patient consultations. Allow only in-house staff to manage the telemedicine platform without external audits. It's B. Implement robust encryption and data protection measure for the telemedicine platform. For them, secure the hospital faces challenges in recruiting and in retaining skilled healthcare professionals. Which function of hospital management is possible for addressing staffing issues and ensuring a qualified workforce, whether HRM, financial management, marketing management, supply chain management, or the quality management? It is the responsibility of human resource management. Fifth MCQ is hospital has experienced a decline in patient satisfaction scores and an increase in medical errors. Which function of the hospital management person is responsible for addressing these issues, whether quality management, financial, human resource, supply chain, or marketing?
A.
Yes, it's quality management team. A surgeon performed a laparotomy in OT and instruments being delivered in OT were absolutely correct and are on the right time. In which category of management is it falling, whether personal management, financial, time, material, or human resource planning?
C. C.
It's material management D. Seventh MCQ is administration of tertiary care hospital decided to build new block of for the expansion of the hospital. Which type of budget will be used for this purpose by finance department of the hospital, whether developmental budget, non-development budget, budget of organization, donation for various organization, fundraising project?
A.
Yes, it's developmental budget. In XYZ the government has approved the construction of hospital in which the number of beds is 20 to 100. In which category this hospital is falling, whether tertiary care, teaching, district, basic, or rural? It's rural health.
A.
No, it's rural healthcare center, not the tertiary healthcare center. The hospital has noticed a consistent increase in patient complaints about the long waiting times at the reception and disorganized appointment scheduling. What could be an effective solution to address this issue? Whether hire additional administrators staff to handle complaints, reduce the number of available appointments to manage workload, implement an online appointment booking system, increase the number of non-essential administrative tasks, or implement the mandatory patient surveys for appointments. Uh, most of the options are correct, but the most suitable will be they have to implement an online appointment booking system for the patients so that the waiting time has been reduced. Last MCQ is the hospital experience high turnover rates among nurses, leading to staffing shortage and reduced patient care quality. What could be done to address this issue effectively? Whether increase the number of non-patient care tasks assigned to nurses, decrease nurse training and orientation programs to save time, implement a recognition and reward program for nurses, or hire more administrators to handle nursing tasks, or decrease the nurse salaries to allocate funds elsewhere.
D.
It's C. Implement recognition and
C.
program for nurses. It's C. This is the key of the MCQs. This is our YouTube channel where all the presentations by the postgraduate students are uploaded here. And thank you very much for today's presentation.